Hi guys, welcome to the show. It is your girl Sarah right here on Relax Radio, and I am super excited to be here because we're going to be talking about a lot of interesting things, but also because I'm going to make sure that you are always informed and updated about everything that happens here in the United Kingdom, but also all over the world as well, right? So make sure to stay tuned and make sure to stay informed by being a part of Relax Radio because all you need to do is, in fact, to go like us on Facebook, follow us on Instagram, Twitter, and TikTok, and also to subscribe to our YouTube channel, all right? And that way you can actually make sure that you're always informed and updated about the very latest in terms of science, sports, health, technology, whatever it is you want to be informed about. You're going to be informed about all of it only on Relax Radio, all right? So don't forget to do that. And now let's actually, or rather, before we head into our conversation, I want to very quickly tell you that you can get in touch with me. All you need to do is just text me or call me on 078 share your thoughts, share your opinions, and even your experiences with me because I would absolutely love to hear everything that you have to say. All right. And don't forget to download the app as well because that's available completely for free on both the Apple App Store and the Google Play Store for your convenience. All right, so make sure to go download that because we want to make sure you're always informed and you're always updated with the very latest conversation. So don't forget to be a part of this show and share your thoughts and opinions with me. All right, but now let's actually talk about how coronavirus cases in England are in fact 26 times higher than what it was last year during this exact same time. All right, now obviously the reason we need to talk about this, or the reason we need to, or rather I need to share my thoughts and opinions with you on this, is because we have been vaccinating people. We've even extended the age of vaccinations because now even 12 to 15-year-olds can actually go and get vaccinated. All right, so because we have extended these vaccinations, because we have actually made sure that people can get vaccinated as much as they can, why exactly is it that these coronavirus cases are 26 times higher than what it used to be last year? All right, now I know these are all questions you have, but don't worry because I'm here to answer all of them and hopefully make sure that you are always informed and updated about all of these questions. All right, and now let's actually head into that conversation because I have so much to share with you. Now, coronavirus infections in England are, in fact, like I said, 26 times higher than the levels that were there last year during this exact same time. And this was actually according to statistics from the Office for National Statistics. And scientists have, in fact, described the figures as sobering. All right, because the truth is, even though we've gotten people vaccinated, the truth is right now, all around the country, schools are opening, we're having music festivals, universities are opening, we're having tourists, and the truth is we can't really curb the spread, or we can't flatten the curve or stop the spread if people aren't going to if people aren't going to take the necessary precautions that they have to take. Right now, I know on the 19th of July they essentially removed this legal requirement to wear masks and whatnot, but the truth is, even then we still have to make sure that we are, we're smart enough to take the necessary precautions that we need to take. All right, now they also warned that reopening of schools in England this week was in fact very likely to trigger further rises in COVID cases, with actually much more to follow when students return to universities and colleges. Right now, a fresh wave of infections could in fact lead rather to new social restrictions being imposed as winter approaches. Now, like obviously we all know, when it comes to winter is in fact flu season. All right, we know that when it comes to winter, there is a much higher chance of you getting the flu. So right now with winter, winter approaching as well, what's going to happen is these cases are in fact going to rise, and that will in fact lead to all of those social restrictions being placed upon us one more time, right? And the truth of the matter is, no matter how much you complain about, look, what, the pandemic is over, or the pandemic, or rather we've gotten over the pandemic because we don't have to wear masks and whatnot, the truth is we're still stuck in that, it's square one, because we haven't really taken those steps the way we should have taken them. Right, the extent to which we follow these precautions precautions and these restrictions weren't actually, followed the way it should have been, right? And also, as a result of all of this, pressure is in fact mounting on the JCVI to approve the deployment of booster jabs for vulnerable people across the United Kingdom, but also the extension of vaccinations to most 12 to 15-year-olds. All right. Now, this latter move would actually bring the United Kingdom in line with the United States and most large European nations, and it's also backed by most ministers. All right. Simon Clark, who happens to be an associate professor in cellular microbiology at the Reading University, essentially said that in this week ending, the week that was ending on the 20th of August, the ONS actually estimated that 756,900 people in England were in fact infected with COVID-19, which essentially equated to basically one in 70 people having COVID-19. All right. So it's very important that we, now that we have the statistics, now that we have the evidence, that we take those precautions that we were taking before they said there's no legal requirement to wear masks and whatnot. Because the truth is, you and I, we don't want to go back to how that was, right? We don't want to, be stuck at home. We don't want to have a lockdown and a really long lockdown at that as well, and work from home all over again, right? So it's important to keep that in mind. But right now, let's actually head into a small break, and after that we will be back to discuss this further. So until then, make sure you stay tuned. Hi guys, welcome back to the show. It is your girl Sarah right here on Relaks Radio, and I am super excited to be here. All right, now currently we're talking about how coronavirus cases in the United Kingdom right now are in fact 26 times higher than it was last year, and we're going to be talking about why exactly that this is, what exactly needs to be done to prevent this from rising further, and also to make sure that we're all safe and we're all safe through for the rest of this year. All right, so that is what we're going to be talking about. Now, if you want to share your thoughts and your opinions with me, please feel free to go ahead and do that, because all you need to do actually is just to text me on 078 all right? So share your thoughts, share your opinions, because I would love to hear everything that you have to say. But also, while you're at it, something else that you can do is to go like us on Facebook. Now, you can like us on Facebook, follow us on Instagram, Twitter, and TikTok, and also make sure that you are listening to us on our app, because that is available on both the Apple App Store and the Google Play Store as well. Okay, so don't forget to download the app and share your thoughts and opinions with us, because the app is available on both the app stores for your convenience, right? We want to make sure that you can listen in from either your iOS device or your Android device, and hopefully be informed and updated about everything that is happening as well. All right, so don't forget to share your thoughts, share your opinions, follow us on our socials, and to get in touch with us, and download our app either. All right, and it's going to be absolutely amazing as well, so please do feel free to go ahead and do that. And right now, let's actually head into our conversation. All right, now, like I said, we were talking about how coronavirus cases in the United Kingdom have in fact increased, and they're in fact 26 times higher than it used to be last year. And this time last year, the ONS actually estimated that 28,200 people in England were infected, right? That is the equivalent of one person in 1,900 being infected with COVID-19. All right. And what it means is that community infections are in fact 26 times more common now than they were a year ago, when the population was unvaccinated and the country was 3 months into its reopening. Okay, the fact that deaths and hospital admissions from COVID-19 are in fact a fraction of their levels at the height of the outbreak in Britain actually demonstrates the protective power of vaccines, right? Because more than 60% of the UK population has in fact had two jabs. Okay, so it's important. I feel like even now, even with so much of the population vaccinated, there is still vaccine hesitation among certain people, right? And I feel like we definitely need to do more, or educate people more in terms of vaccinations, and help people understand, what vaccinations aren't actually a bad thing. They're actually very good, because they're going to help make sure that you reduce that rate of infection, you reduce your risk of death, and you keep yourself and your loved ones safe as well. Because the truth is, look, we can't be stuck at home forever, right? I mean, sooner or later we have to head out into society, and we have to learn to live with the virus. And the truth is, obviously, one way to do that is by getting vaccinated, because then you have a much lesser chance of you actually getting COVID-19. And that's why it's very, very important for everyone who can actually, to go and get vaccinated, right? Because vaccinations are available for so many people, and the truth is, in my opinion at least, vaccinations, when they're available to you, you should definitely go and get vaccinated, right? Because there are so many people in this world who don't have the ability to get vaccines, because either they're from poor countries, and these poor developing countries haven't been able to access vaccines or buy stocks of vaccines the same way that we can. So when you have the opportunity, it's very important that you make use of that, because there are so many people in the world who are suffering because they haven't been able to get vaccinated. Okay, now, the last time infections were at their current level in England was in fact late January. All right, so so just to make sure that you are much safer and much protected from all of this, the best thing to do is to actually go get vaccinated. All right, now there were around 2,300 daily hospital admissions and 1,100 deaths a day. Right now, by contrast, the most recent daily figures for England are about 770 hospital admissions and about 80 deaths. Okay, so that is why vaccinations are important, even though it's 26 times higher. The infection rate is 26 times higher than it used to be, because this Delta variant is super infectious. What it's also showing is that the people who are dying and the people who are admitted to hospital have in fact reduced drastically, right? Because in terms of in terms of all of the deaths that were happening at that point, it was 1,100 deaths a day. Now it's just 80 deaths. Okay, so it's important to remember that as well, right? Now, increasing numbers of community infections still translate into growing numbers of very sick patients, and also an unnecessarily high burden on the NHS, right? In addition to even the cooler autumn weather has or rather the cool autumn weather leading to increased indoor social mixing was also likely to drive further increases in coming weeks. Right now, the truth is, even though we've made so much progress and whatnot, the high case levels across the country, as countries are in fact still worrying to scientists, because they're still very, very concerned, because at the end of the day, the main role is to actually flatten that curve, right? You want to make sure that no one else gets infected. You want to make sure that even that rate of infection is in fact reduced, right? So it's important to actually keep that in mind. Now, the end of summer holidays and return of people to work and education without actually clear guidance on physical measures to avoid transmission, such as mask wearing or social distancing, is also very likely to push up infection rates. All right, so it's important to keep that in mind. And now we're actually going to head into a small break, and after that we will be back to discuss this further. But until then, make sure you stay tuned.
The valuations that you place on an asset are always behind you. It's always in hindsight. It's never in front of you. And that's one of the challenges, right? Because you're always valuing what happened yesterday, and what you need is what's going to happen tomorrow. What am I saving